There is a disease that has been spreading rapidly and is causing apprehension throughout the healthcare communities. One of the primary concerns is that it has been mutating about 6 to 12 times faster than predicted. In this video, I will cover what monkeypox is, what the dangers are, and finally what you can do to prevent it or treat it if you are infected. As the name suggests, monkeypox is a poxvirus that belongs to the genus Orthopoxvirus in the family Poxviridae. It is a double-stranded DNA virus that is related to both smallpox and cowpox viruses. It is not related to chickenpox, however. Normally, the orthopoxviruses are thought to mutate 1 or 2 times every year. But, when comparing the genome of the recent monkeypox virus to a previous outbreak version, they found close to 50 mutations. Much more than was anticipated. Monkeypox was discovered in 1958, but the first human case wasn't recorded until 1970. Until recently, monkeypox has mainly shown up in Africa. Recently, however, due to an outbreak of monkeypox and the ability of fast travel, it has been found in over 50 countries. The primary carriers are African rodents and non-human primates. Like monkeys, these animals might harbor the virus and continue to infect people. Is monkeypox deadly? The most recent strain of monkeypox is a strain from West Africa. It is painful, unpleasant to see or have, physically and emotionally scarring, but rarely fatal. In fact, over 99% of the people who get this form of the disease are likely to survive. There is a population of people that are more likely to die from this disease, however. The destruction of the protective layers of the skin and the impact that it has on the immune system cause people with weakened immune systems, children under 8, people with a history of eczema, and people who are pregnant or breastfeeding cause for alarm. These are the populations that may be more likely to get seriously ill or die. Am I likely to get monkeypox? The WHO updated monkeypox to a moderate global health emergency. Currently, in the United States, the risk of becoming infected with monkeypox is low, but cases are growing. Monkeypox does not spread as easily between people, and there is a longer time between exposure and when symptoms begin. This gives health officials, such as the CDC, more time to track down infected people and break the chain of infection so that a pandemic or mass infection does not happen. The symptoms of monkeypox include many common immune responses, so it initially looks similar to other illnesses. Monkeypox may present with fever, headache, muscle aches and backache, swollen lymph nodes, chills, fatigue or exhaustion, a rash that can look like pimples or blisters that appears on the face, inside the mouth, and on other parts of the body, like the hands, feet, chest, genitals, or anus. Additionally, the sores from the rash may be inside the body, including the mouth, vagina, or anus. The rash goes through different stages and physical appearances before healing completely. The usual order is that people will get a fever, then 2 to 4 days later the rash will appear. The rash will progress for 2 to 4 weeks. The telltale symptom that many relate to monkeypox is that of swollen lymph nodes. Everyone is different, however, and sometimes people get a rash first, followed by other symptoms. Yet, others only experience the rash. Let's cover how monkeypox is spread. Monkeypox spreads person to person in, primarily, 3 different ways. Those are contact, airborne, and through pregnancy. Spread through contact relies on direct contact with the infectious rash, scabs, or body fluids. Monkeypox is also spread through touching contaminated items such as linens, clothing, or surfaces that were exposed to the fluids. Airborne spread relies upon contact with respiratory secretions during prolonged, face-to-face contact, or during intimate physical contact, like kissing, intimacy, and/or sex. It is currently not as easily spread as the COVID virus we have dealt with the last number of years. Lastly, pregnant women can infect their offspring through the placenta. In addition to person-to-person contact, it is also possible to get monkeypox from infected animals. A scratch or bite by the infected animal is enough to pass along the virus. Additionally, preparing or eating an infected animal's meat may also cause an infection in the person. The virus is usually active and can be spread from about 4 days after the onset of the fever until the rash has fully healed and a fresh layer of skin has formed. It is thought that people who do not have monkeypox cannot carry the virus to others. We do not have enough information to know if monkeypox can spread through semen or vaginal fluids. So we know the basics of monkeypox, what it does to the body, and who is most susceptible. Let's go over the basic steps of prevention so that we can be prepared. Preventative steps. The best way to prevent getting monkeypox is avoidance. Avoid direct skin-to-skin contact with the monkeypox rash. Do not touch the rash part or scabs of a person with monkeypox. Avoid intimacy with an infected person. Do not kiss, hug, or have sex with someone infected with monkeypox. Avoid sharing items. Do not share food, drink, eating utensils, or cups. Avoid touching clothing and linens of an infected person. Avoid possibly infected animals. Most likely these include rodents and primates or monkeys. Hygiene. Wash your hands with soap and water for at least 20 seconds. Do this often or use an alcohol-based hand sanitizer, especially after contact with sick people. As a note, it is better to wash your hands than to rely on multiple uses of the alcohol-based sanitizer. If you are sick, please stay at home and isolate yourself from other people. Contact your physician for additional assistance and to monitor the disease. It goes without saying that people who maintain their health and have high-functioning immune systems are better able to combat viral and bacterial infections. So keeping yourself active and healthy with a peak-performing immune system will go far when dealing with various infections. Another form of prevention is that of vaccination. Currently, the Center for Disease Control does not recommend mass vaccination against monkeypox at this time. Your physician may suggest vaccination if you meet certain criteria, such as if you are in close contact with an infected person, have been exposed to the virus, or have an increased risk of being infected. There are 2 monkeypox vaccinations that are in current use. The U.S. Food and Drug Administration, FDA, has approved these 2 vaccines for preventing a monkeypox infection, JYNNEOS, also known as Imvamune or Imvanex, and ACAM 2000. There is a surplus of the ACAM 2000 vaccine, but a limited amount of the JYNNEOS vaccine. Each of the vaccines have their merits and drawbacks. We will briefly go into them now. The JYNNEOS vaccine utilizes a live virus that does not replicate in human cells. It is licensed by the FDA for use for those 18 years or older. It is based on research of animal studies. As a note, people with a severe allergy to any component of the vaccine, such as gentamicin, ciprofloxacin, or egg protein, should not receive this vaccine. This vaccine is safe to use for people with HIV and atopic dermatitis. It is thought that there are no additional risks for those who are pregnant. As mentioned, this was based off of animal testing, as there was little to no data with pregnant humans that were vaccinated with this. The JYNNEOS vaccine is distributed to those who have a known sexual partner in the past 14 days that was diagnosed with monkeypox, or who has had multiple sexual partners in the past 14 days in an area that is known to be a region of a monkeypox outbreak. Because of the limited doses, the JYNNEOS vaccines are being prioritized for those people who could have the severe adverse side effects from the ACAM 2000 vaccine. The ACAM 2000 vaccine is a live vaccinia virus vaccine that is replication competent. It is administered by way of a percutaneous dose using a bifurcated needle. Think of a forked needle. Immune response is within 4 weeks. This vaccine was originally created to combat smallpox, but has been used against monkeypox in emergencies. Some of the things that you want to keep a lookout for are the adverse reactions. The reactions are more widespread and the population is more exclusive. Some immediate concerns are injection site pain, swelling, and redness. As with the reactions, they are similar to the infection itself, presenting with fever, rash, and/or lymph node swelling. The amount of people that can receive this vaccination is more limited than the JYNNEOS vaccine. Health administrators try not to give this vaccine to people that have allergies to any component of the vaccine. People with severely weakened immune systems, have cardiac disease, HIV, atopic dermatitis, eczema, eye diseases that were treated with topical steroids, infants, or those that are pregnant. Those were the methods for prevention. Now we will address treatments for those that are currently infected. Unfortunately, there are no treatments specific for monkeypox infection. However, monkeypox and smallpox viruses are genetically similar, so the antiviral drugs developed to combat smallpox may help treat a monkeypox infection. One antiviral that is useful for treating monkeypox is tecovirimat, otherwise known as TPOXX. It may be recommended, especially because it is also good for people who have weakened immune systems. To wrap up, the recent outbreak, rapid mutation, and spread of monkeypox is definitely a cause for concern. It is important to be aware of the symptoms of monkeypox and to take precautions to avoid becoming infected. There is no cure for monkeypox, so early diagnosis and care is essential for preventing serious complications. There is also no specific vaccine available to prevent monkeypox, so it is important to practice good hygiene and avoid contact with infected individuals. It is important that individuals take the necessary precautions to protect themselves from exposure, and that public health officials continue to monitor the situation closely. If you do find yourself having new or unexplained rashes, sores, or other symptoms, contact your healthcare provider. That concludes this video. Thank you for watching. Please like and subscribe.